In this video, we're going to go over the lymph system, which is not only a pretty short chapter, but it's a relatively simple chapter to understand. So we're just going to kind of go over the more complicated parts. So for some of the slides, you might want to just pause it to get what you need, including this one because it's pretty easy to find it. Major organs, fairly simple. So again, just pause it if you need it. For this one, I'll pause a little bit on, but lymph. So the fluid that's in your body changes names based on the location of that fluid. Honestly, it is mostly the same composition depending on where it is. I mean, you might change the protein levels, but it's really the same basic stuff. So that fluid, when it's in your blood, it's called plasma. Once that fluid leaks out of the blood vessels, then it's called interstitial fluid. Once that fluid enters a lymph vessel, it's called lymph. That same fluid, when it's in your ventricles in your brain, it's called cerebrospinal fluid. So again, same stuff, just different locations essentially. In this chapter, we're going to be talking about lymph. And so be focusing on that. Lymph is really just plasma, but it's inside of these vessels that are called lymph vessels. We have completely overlooked these vessels at this point, but they are interwoven with capillaries. They lie right next to arteries and veins. Those vessels are going to help us take leaked fluid back to the circulatory system. One of the important features of this system is that the vessels just start. We do not have a circuit. We do not have a cycle. We do not have a pump. So vessels just start sort of in the middle of nowhere. So your book calls those blind-ended capillaries. So this is one of those nice little blind-ended capillaries. They are made just like your regular old capillaries. There's endothelium that makes them. So remember that simple squamous epithelial tissue. These cells, they have little fibrous connective tissue that anchors one cell, but then the cell right next to it is not going to be anchored on that side. The other end of that same cell, though, it's going to be anchored. Here's what that means. When the plasma starts to leak out of the blood vessels and we start to build up a bunch of interstitial fluid out here in between the cells, that pressure buildup is going to put pressure on this cell right here. Now, this side of this cell can't move because of all of these fibers, but this side of the cell can move because it's not anchored. So that pressure of all of that fluid is going to push on this side of the cell and make it flap open. And now that fluid is going to move into this lymph capillary. And then once we're in here, name changes, and now we are called lymph. So that same exact fluid that had been out here moving around, once it's in here, again, it is called lymph. So this gap between the two cells, it's called a mini valve. Just remember that the only reason that valve is going to open is because of a pressure buildup of interstitial fluid. The reason that that fluid would build up is because an excess of plasma has leaked out of a capillary bed. Now, a lot of the plasma is going to be picked up by the back end of the capillary bed or even by the venules, but also a lot of that plasma does just hang out here and become interstitial fluid. So that fluid that just stays out here, we have to have a way to get that fluid back to circulation so you don't end up with hypovolemic shock that we talked about in the last chapter. Now, lacteals are going to be important for us when we get to the digestive system. They are just lymph capillaries. They are in these structures called villi in the small intestine. We'll come back to those a little bit later. I'm going to skip the questions to get us through here a little bit better. So this picture shows you which parts of the body drain into the largest of the lymph vessels. The largest lymph vessels are called ducts, which I know sounds like birds, but it's duct. So I'll say that with that nice hard T in there. So we've got two ducts, the right lymphatic duct and then the thoracic duct. I really wish they had labeled that one on the other side. But the right lymphatic duct is going to drain all the parts of the body that are sort of this pea green that you're seeing off over here. So that's the right arm, right side of the chest, right side of the neck, right side of the head. Literally every other part of the body that is body colored in that picture drains into the thoracic duct. So we do not have equal division that is happening here. So both legs, right and left, drain into the thoracic duct. Most of the abdominopelvic cavity drains into the thoracic duct. Left arm, left chest, left head, left neck. those drain into the thoracic duct. So again, unequal distribution is what we have going on there. Okay. This picture I leave in here just to show you where the right lymphatic duct and the thoracic duct empty in. Again, we did not talk about this when we were doing the circulatory system, but here is where the right lymphatic duct drains in. It is right at the brachiocephalic vein, which is going to be where we drain into the superior vena cava. Thoracic duct comes in right at the left brachiocephalic vein, essentially. And so really we're dumping in right before the heart. The lymph is getting emptied right back in, basically right before the right atrium. So that's how we're returning that lymph back to circulation. As the lymph is being transported back through the lymph system, one of the problems is we don't have a pump. So again, pressure is crazy low. So we're going to need those same adaptations that the veins had to try to get the lymph back up towards the heart against gravity. So we still have the skeletal muscle pump. We still have the respiratory pump. We have valves just like we had back in veins. And the venoconstriction that we had for the veins, we have that in lymph vessels too. So here's the difference though. In veins, we could do it whenever we needed to increase venous return. And lymph vessels, they will actually contract rhythmically, more like a peristaltic contraction, like what we have in the digestive system, to try to rhythmically keep that lymph moving back up towards the circulatory system. Also, our lymph vessels tend to lie right next to the arteries, and so the pumping of the arteries can tend to kind of move the lymph just a little bit as well. So, lymph basically moves by the same action of veins, only we also have rhythmic contractions. It's going to keep it moving. Oh yeah, gross picture. Sorry, should have probably warned you. So, I always like to ask, what does this person have? And I always get sort of different answers that are going in there. So this is where I wish you guys could talk to me. I wish we had discussions, but they never really work in an asynchronous format. This person has gangrene. We are not okay, essentially. Gangrene is a bacterial infection of the foot, which means we have bacteria circulating in the interstitial fluid. It is not okay at this point. So I had a coach back in high school, and no matter what was wrong with you, he would always tell you walk it off. He literally told a person with a broken foot to walk it off. We did not like that coach, incidentally. So if this person showed up to tennis practice, he would probably tell this person to walk it off. My question for you guys is, should he walk it off? And hopefully you're shouting at the screen, no, because if you were to walk this off, what that would do, remember, because of that skeletal muscle pump, that would increase lymph flow. Increasing lymph flow would increase the spread of the bacteria and make it more likely that you would develop sepsis. And so this is one of those times where instead we want to keep that foot as stationary as possible so that we do not spread the infection and we keep it in one place. Okay. Lymphedema is what we've got next. I like this picture because it shows you the importance of the lymph system. Nobody ever seems to remember this. Your lymph system's job is to return fluid to the circulatory system. This is what happens when the lymph system does not work. So it shows you how much fluid you would build up would your lymph system back up or not work like it's supposed to. Lymphedema is fluid buildup because the lymph system is not working correctly. This could happen because you've got some sort of blockage. This could happen because you've had cancer and you've had to have some of your lymph vessels removed. Let's see, I don't have a note that tells me why this woman ended up developing her lymphedema. It could have been because of any of the reasons that I described earlier. But what they've been doing on her is what's known as combined decongestive therapy. So her before picture is what you're seeing on the left here. And you can see she's very congested. She has a lot of edema. What they do during the decongestive therapy is compression bandages to squeeze that fluid back up against gravity towards the circulatory system. They can also do draining, so they might put, well, you can picture what draining is going to look like in this case. We're going to do exercises to increase that skeletal muscle pump that we were talking about just a second ago to the best of our ability. We might use some of those inflatable booties that we had seen in previous chapters when we were talking about COPD. The picture on the right is 5 weeks after she initiated treatment. So regardless of what her problem was, you can see she does look a lot better. Is she 100% better? No, not at all, but she is definitely on her way towards getting better. Just like you can build new blood vessels, you can build new lymph vessels. And so she is getting her lymph system restored through her decongestive therapy and then just time as well. Next picture is also disturbing. So this person has, it's actually one of your related clinical terms at the back of the chapter that I'm going to harp on another slide too. This person has really severe lymphedema as a result of something known as elephantiasis, which again I will come back to in just a second. This is a filarial worm infection. It kind of shows you what it looks like from the bottom. I don't think people realize how much the feet sort of get swallowed in the case of elephantiasis. So imagine that we were looking at the bottom of this person's foot and it would have looked like that preceding picture. So like I say on the slide here, everybody likes to say elephantitis. Elephantitis would mean your elephant is inflamed and you do not have an elephant. Elephantiasis means you have a worm infection that's making you look like an elephant, which is kind of a rude thing to say, but I think we can all see where you get the name from. Elephantiasis is a filarial worm infestation. You can see the worm that is being pulled out of this person. They like to travel around through the body. They will often get stuck in lymph nodes as they're traveling, and when they get stuck, they block lymph flow. And so all of this swelling, it's a very severe form of lymphedema, but because it has a specific cause, it has its own specific name. So elephantiasis is a form of lymphedema caused by that worm. You don't see this in the States for a number of different reasons. Most notably, we have treatments for worms. That's what ivermectin is for, is worm infections. Okay. Lymphocytes. These are one of our blood cells we talked about previously. They're called lymphocytes because they hang out in the lymph system. Plasma cells. I don't think we've talked about these before. Well, no, we did when we were talking about lymphocytes, talk about B cells and T cells. B cells can differentiate into plasma cells. Plasma cells are going to be sort of the snipers of the B cells. They will shoot out antibodies that can attack pathogens. So they're one of our types of lymphocytes. These cells will also hang out in lymph tissue. And so that's why we're talking about those here. Macrophages we have talked about in a lot of detail earlier. So all of these types of cells, lymphocytes, which include plasma cells and T cells and the other B cells as well, including memory cells, and macrophages, they're all hanging out in all of our lymph tissue, including our lymph nodes. When we talk about tissues filtering out lymph tissue or filtering out blood, it's not necessarily the tissue that's doing it. It's the macrophages and the plasma cells and the lymphocytes. They are eating out the pathogens. That sounded dirty. They are eating the pathogens, or they are using the antibodies to agglutinate or precipitate pathogens or toxins. And so that's how they're filtering. It's the cells that are in there that are doing the work of the lymph tissue. Dominant type of lymphoid tissue is the reticular tissue from last semester. Body regions with large clusters of lymph nodes is the cervical region, which is the neck, the axillary region, which is the armpits, and then the inguinal region, which of course is the groin. Anytime you get, like you go in and you say, I don't feel good, and your doctor starts poking around your neck, and they say you have swollen glands, they actually mean you have swollen lymph nodes. If you're sick, your lymph nodes are going to start to get congested with some of whatever is making you sick, whether it's virus or bacteria or fungus or whatever, plus the lymphocytes and the macrophages that are trying to help you get better. So they will swell with all of the things that are making you sick and trying to get you better. And so the doctor's feeling to see if they're swollen, which would tell him, yeah, you really are sick. If you've been really sick, you might have noticed when you're putting on deodorant that, yeah, like you have some areas in your armpits that hurt, and that's your axillary lymph nodes that are hurting, just like the ones in your neck might hurt. If you've ever had an STD, you might have noticed the same thing in your inguinal nodes, but we won't talk about that. All right. Functions for your lymph nodes. They filter out any pathogens that are circulating in your lymph stream. And again, that's really because of all those cells that we were talking about a second ago. Also, because the lymphocytes are hanging out in your lymph nodes, that means we can directly activate your entire immune response. And so your lymph nodes are going to help you activate your immune response as well. Gave you that picture, pause it, label it. This is your anatomy of a lymph node. What I want you to primarily notice is we have more vessels bringing lymph into a lymph node than we have taking lymph out. That is going to make lymph move slowly through the lymph node so that we have enough time to process all of the lymph as it moves through there. So basically, a bunch of lymph is trying to come in here, but because we only have this little bit coming out, we get this backlog and it has to slow down. As it's slowing down, all of these little macrophages and neutrophils and lymphocytes and plasma cells and T cells and memory cells, they have a lot of time to process all of this lymph that's coming in so that by the time the lymph finally gets to leave, most of the pathogens have been removed. Buboes are swollen lymph nodes. This is another one of my favorite words because it just sounds so silly. So when your doctor again feels your neck and says you have a swollen gland, he really means swollen lymph nodes. Also, to throw you back to old-timey stuff, back in the 1300s when we had the plague, it was the bubonic plague. It was called that because the bubonic plague leads to buboes. So there's your history lesson of the day, I guess. Location and anatomy of the spleen. So it is in the abdominal cavity. It is just lateral to the stomach. A lot of people confuse it with the liver because it can look dark like the liver, but it's not the liver at all. But it is, up there on the opposite side of the stomach from the liver, though. Let's see, lymphocyte proliferation is a word that's going to come up in the functions for the spleen. Lymphocyte, again, a type of white blood cell. Anytime you see that word proliferation, it means to make more of something. So the spleen is a place where we can make more white blood cells. So that's one of the functions for the spleen. Spleen is also a filter, but it doesn't filter lymph. That's the lymph node's job. It filters blood instead. We had already talked about the fact that the spleen is the red blood cell graveyard. The spleen can actually store some platelets, so it can help you with your blood clotting function. It can store monocytes, so it can help you kick monocytes out should you get a chronic infection. And in a fetus and in a severely anemic adult, it can make some red blood cells. This shows you what a pretty healthy spleen had looked like in a person. Nice red, again, very livery looking, a healthy spleen. Spleen has a thin capsule. Why is that medically important? Well, it ruptures really easily. Spleen is normally protected by the ribs. If a person gets an infection and it swells, it can actually swell and start to hang lower than the ribs. And then if you get hit even just a little bit, it can actually rupture that spleen pretty easily, sort of like an overinflated water balloon. This is one of the reasons why if guys in Texas get sick, they will not let them play football. It's because if you take like a helmet to that side of your body, it can pop your spleen like a balloon. So both of these pictures, this one shows you an actively bleeding spleen where the capsule's been ruptured and we're bleeding right through here. This they are probably still going to be able to fix. We can just slap some sealant on there essentially and fix that. This one, it ruptured so much and would have been bleeding so much that they just full on removed that spleen. Now, in a lot of cases, and especially in the past, if you had a ruptured spleen, they would just go ahead and take it out. Your liver could take over a lot of the functions for the spleen, and you could probably live a pretty normal life if your spleen had been removed. They did that because, again, your spleen is so vascular, you would bleed so much that it was just less risky to go ahead and take the spleen out. Nowadays, though, they try a lot harder to try to leave the spleen in. Now that we have better sealing technologies, they try a lot harder to keep it in there. So, I don't know. We're getting a little bit better about some things. This one is really not so much about the capsule. It's just to show you the spleen is sort of a delicate little thing. It's a very delicately arranged little thing. The pedicel is what contains the blood supply. So the splenic artery and the splenic vein connect to the spleen and then connects to the abdominal aorta and then the inferior vena cava. If the spleen twists even slightly, that leads to what's known as this twisted pedicel. If it twists it kinks the artery. And if the artery gets kinked, kills the whole spleen. So notice how in this case, this spleen is necrotic. That is dead spleen. Versus here, everything is nice and red and happy looking, although we do look like we have some bleed going on right there in that case. So that's another thing that can happen to the spleen, is it twists around the pedestal, and then we've got to take it out because that's, again, full on dead at that point. It's just got to go. Was there anything else I wanted to tell you there? Oh, well, once again, this is a dog, just in case you were wondering. We're doing a splenectomy, which is the removal of the spleen, and in this case, it's because of the twisted pedestal. All right, thymus gland. We talked about this back in chapter 16. I think I already mentioned everything on that, so you can get what you need from the slide. Tonsils. Tonsils are one of those things where, like, there's this fad that comes around where let's just take everybody's tonsils out, and then it's, well, no, let's leave everybody's tonsils in, and then it sort of comes back around where let's take tonsils out again. Tonsils do have a function. I like to sort of consider them bacterial gardens. There are places where you on purpose grow bacteria because you have lymphocytes that hang out in your tonsils. And here's the thing about your lymphocytes. They have to meet their specific pathogen in order to fight their specific pathogen. If they never meet it, then they don't know how they're supposed to fight it. So your body is on purpose creating a garden so that your lymphocytes have, in theory, a safe place to meet the bacteria so that they can learn how to fight them, so that if you get exposed to it in an unsafe manner, you will have your army ready to fight it in the future. The issue with that is you have created a bacterial garden. They're going to get infected, and it's going to happen all the time. If they get so infected that they actually occlude the airway, that is problematic. And so we will remove the tonsils if they are making breathing difficult. However, if you remove the tonsils, you are losing that safe meeting place. So there is a slight decline in immune function, and we would ideally like to not see that happen. Now, once again, I'm going to play this video of a tonsillectomy to show you what it looks like. I'm hoping that this doesn't end up getting this video blocked eventually. We'll see how it goes. Tonsillectomies at this point are done with a cautery instrument. I didn't have my computer sound turned on. So this is the palatine tonsil. That's the uvula. They've already removed the palatine tonsil on this side. So we're, patient is fully unconscious for these procedures. They're going on with the grabber. This is the cautery instrument. If you've never been in the room for a cautery, cautery is we are burning the tissue off. And so we're sort of barbecuing a person as we do this. Risk of infection is low. It seals the wound so you don't bleed as we do it. But the smell is, you can't describe the smell. Like, go and pluck some of your hair and burn it, and that gives you something of an idea, but this is a whole different thing. So it's unpleasant, to say the least. This also shows you why you have, like, the most hellish sore throat after you've had a tonsillectomy. It's because you have a burned wound in your throat in two places, because there's two palatine tonsils, one on each side of the back of your throat. But this is what a tonsillectomy looks like for an unconscious person. And we're just full on removing those palatine tonsils. Now, you do have additional tonsils. You've got pharyngeal tonsils and lingual tonsils. You also have tubal tonsils. But the palatine tonsils are sort of the most active ones. And so they're the ones that get the most swollen, which is why they're the ones that are the most often removed. This also does, I mean, this is real time, so this shows you it's not a crazy long procedure. Although do keep in mind this was just one tonsil. They had to do the other one, so this would take twice as long, and you, of course, didn't get to see the anesthesia process. But voila, all done. That's how they do a tonsillectomy. Oh, don't know. I'm glad I didn't have a grade book posted, I guess. So these are where your basic tonsils are. You just saw the palatine tonsils being removed. You also have lingual tonsils at the back of the tongue. And then the pharyngeal tonsils are also called the adenoids. So if you've ever heard of adenoids, that's these guys. The pharyngeal tonsils are more problematic for people who have sleep apnea. or they snore vigorously, I'll say, that tends to be these guys that are more problematic. Then I gave you this picture just to label your basic anatomy. So these crypts that are in there, essentially this is you creating a warm, moist environment for bacteria to come and grow. All of these places where you have germinal centers, that's places where you are going to be housing lymphocytes, macrophages, again, those same B cells from earlier. So this is where all of your army is coming for basic training so that they can meet pathogens in these crypts and then learn how to fight those pathogens. That's their function for your tonsils. Pyrus patch is essentially doing the same thing, but they're doing it in your intestines. After that, you just have your related clinical terms, and so that's your lymph system.